Hey there, welcome to our channel. We've got a super important topic to discuss, contraceptive methods. We're diving into IUDs, birth control pills, female condoms, and fertility methods, all tailored for you, amazing teenage girls. Starting with the IUD, it's like a tiny T-shaped warrior that's placed in your uterus. It says nope to sperm and it's over 99% effective, what's not to love? Next, the birth control pill. Pop one every day and it says bye-bye ovulation. It's super easy to use, but it's most effective when taken at the same time every day. Now, the female condom. It's like your secret shield, providing a barrier that stops sperm in their tracks. Just be careful when you open it and you're good to go. And finally, fertility methods. It's all about tracking your menstrual cycle. It's hormone-free and totally natural, but it requires precision and consistency. So, here's the deal. We're going to break it all down. We're talking about effectiveness, pros, cons, and how they actually work in your body. You ready? Let's go.
Let me introduce the intrauterine devices, also known as IUD, to you. It is one of the most effective forms of contraception available today. An intrauterine device is a birth control method that uses a tiny T-shaped plastic device. It is placed within the uterus and remains there to stop conception. There are two types of IUD, the copper-containing IUD and levonorgestrel-containing IUD. Both have similar rates of preventing pregnancy. Copper-containing IUDs have a 0.08% failure rate, and levonorgestrel-containing IUD had a 0.02% failure rate. This increases the effectiveness of these devices to over 99% in preventing pregnancy. Next, I will talk about the insertion process of an IUD. Usually, an IUD is inserted by a doctor or nurse when you are menstruating. The doctor cleans the cervix with an antiseptic solution prior to implanting the IUD. A plastic tube carrying the IUD is inserted via the vagina and into the uterus by the doctor. Next, a plunger is used to force the IUD into the uterus. At the end, take out the tube, leaving two little strings hanging in the vagina outside the cervix. When it's time to remove the IUD, the strings are used to draw it out of the uterus and to ensure that it stays in its correct place. After the insertion of IUD, copper is released into the womb. It becomes more difficult for sperm to access and survive on an egg when the cervical mucus is changed by the copper. Additionally, it may prevent a fertilized egg from attempting to embed itself. This is how the IUD works as a contraceptive method. The following are a few benefits of IUDs. Depending on the type, it offers 5 or 10 years of contraception protection. Furthermore, there are no hormonal side effects such as headaches, acne, or discomfort in the breast. Moreover, using an IUD while breastfeeding is safe and does not interfere with sexual activity. Also, there is no proof that using an IUD would change your weight or raise your chance of developing ovarian, uterine, or cervical cancer. It's crucial to remember that IUDs have a certain possible drawbacks just like another medical procedure. You might have mild to moderate pain during insertion, cramps and pain, and lightheadedness or dizziness. After the insertion, some women have backache and cramps for 1 to 2 days. Your menstrual cycle may become heavier, longer, or more painful after the procedure. Additionally, it does not offer protection against STIs, so you might also need to use condoms.
The most common method of the reversible contraception use is the oral contraceptive pill. It is quite effective at reducing adolescent pregnancies while increasing access to hormonal contraceptives. The two varieties of OCPs are progestin-only pills and combined oral contraceptive pills which contains both estrogen and progesterone. The combined oral contraceptive pills can be either multiphasic, where doses of both or either component in the active tablets every week varies, or monophasics, where the same dose of both components in the active pills is taken. It can be given as a continuous dose when no bleeding occurs, a prolonged dose where there is bleeding every 3 months, or a cyclic dose where bleeding happens every month. The first dose of the pill should be taken every day at roughly the same time. The pills should not be taken after more than 24 hours apart, as this could reduce their effectiveness. The effectiveness of the pill is up to 99% when the application is done perfectly. The progesterone-only pills are used more frequently when the woman wants to stay away from estrogen. To maximize the effectiveness of the pill, It must be taken at the same time every day. If consumption of the pill is started within the first 5 days of the menstrual cycle, you should use a backup form of contraception such as condoms for the first 48 hours after initiation. The progesterone-only pills has an effectiveness of 99% in preventing pregnancy with perfect youth. The primary mode of action is inhibiting follicular growth and stopping the ovulation. The hypothalamus uses progesterone negative feedback to reduce the gonadotropin releasing hormone's pulse frequency. As a result, less FSH and LH will be secreted. Ovulation is inhibited because there is no follicle form and no LH surge occur to release the follicle. Since estrogen slows down the anterior pituitary ability to secrete FSH, it has some effect on follicular growth but is less prominent compared to progesterone. Another mechanism mode is the capacity of progesterone in preventing sperm from getting through the cervix and upper vaginal canal. The estrogen present in the COC raises the risk of venous thromboembolism, hence patients with cardiovascular disease should not utilize COC. Breakthrough bleeding is the most common side effect of the COCs. Additionally, users may have headaches, breast tenderness, increased vaginal discharge, or reduction in libido. Meanwhile, changes in menstrual cycle and increase in acne and unexpected irregular bleeding are the common side effect of the POPs. It frequently results in menstrual alterations but has fewer systemic side effects than COCs. The COC may have some health benefits for some individuals, which include reducing the risk of ovary cancer and premenstrual symptoms. The POP provides an alternative way for the individuals who cannot take estrogen, such as those who have diabetes, a smoking habit, current arterial disease.
Now I will continue to introduce female condom. It is a barrier technique of contraception which works inside the vagina. It prevents pregnancy by stopping sperm from meeting an egg. Based on a study conducted in US, about 85% of women recommended using female condom during sexual intercourse to avoid unintended pregnancies. This is because female condom has a 95% effectiveness in preventing pregnancy, which is considered high when used it correctly. So, how to use a female condom correctly to make it effective? First, open and remove the condom from the package cautiously to avoid tearing. Then, squeeze the inner ring with the closed end of the condom with your thumb and forefinger and then insert it into the vagina. This step is like inserting a tampon. After inserting, push the inner ring as far up as possible until it rests against the cervix by using your finger. Make sure the outer ring at the upper end of the condom remains outside of the body, covering vagina opening. Be sure that the condom is not twisted as well. During intercourse, ensure that your partner's penis enters the opening of the condom. To remove, pull the condom out of the vagina by gently twisting the outer ring. Thus, throw the condom away in trash. Now, let's talk about the advantage and disadvantage of female condom. In most cases, using condom has no negative health impacts. Moreover, they protect us from sexually transmitted infections such as HIV. Oppositely, female condoms are not readily available compared to male condoms, which only account for 1.6% of total condom distribution globally. Lastly, I will introduce a natural method of contraception, which is fertility awareness-based method. It involves identifying the fertile days of the menstrual cycle. To prevent from pregnancy, you need to avoid having sexual intercourse or use a barrier method of birth control during fertile period, which is usually between days 8 to 19 of menstrual cycle. This technique is known as the calendar method. Furthermore, you can also observe fertility signs such as cervical secretion and basal body temperature. Increase in the volume of cervical secretion that are wet, slippery, and transparent indicates that ovulation is approaching. On the other hand, a sudden slight drop in your basal body temperature is also a sign of ovulation. When those conditions occur, avoid having intercourse to avoid getting pregnant. The most effective way to use FAB method is combining those three techniques together, in which the effectiveness can reach 98% if it is perfectly used, but typically it only has a 78% efficacy rate. To know more about FAB method, it is suitable for women who cannot or do not wish to use other forms of contraception due to ethical, cultural, or health reasons, as it is a risk-free, all-natural method of birth control. However, to keep track the exact fertile days, your menstrual cycles need to be consistent for several months, hence the failure rate is high. In addition, fertility awareness methods do not protect against sexually transmitted infection. It can also be impacted by illness, stress, or medication use.
It's almost time to wrap up our journey through the world of contraception. So, to conclude, here's the lowdown on the effectiveness of these methods. Intrauterine devices, IUDs, and oral contraceptive pills, OCPs, take the crown, with a stellar success rate of up to 99%. Next up, we've got fertility awareness-based FAB methods, with an impressive 98% success rate. They're your trusty sidekick in the fight against pregnancy when used perfectly. And finally, we have female condoms, rocking a 95% success rate. They are your least reliable guardians in the world of contraception, among the others. You've got choices, and they're all about keeping you in control of your reproductive health. Finally, it's quiz time. You've learned about contraceptive methods, so now it's your chance to put that knowledge to the test. Don't forget to hit the pause button because answers will be revealed after each question. And there you have it. We've dived deep into IUDs, pills, female condoms, and fertility methods. Knowledge is power, and now you're in control of your choices. Choose what works for you. Stay informed, stay awesome, and remember, it's your body. Don't forget to hit the subscribe button for more awesome content and share this video with your friends. Let's spread the word on taking charge of our reproductive health. Catch you in the next one. Bye!